Do you know when to be concerned about your children's weight? Of course, your children will gain weight as they grow, but gaining extra pounds than what is needed to support their growth and development can lead to childhood obesity. Childhood obesity is a medical condition that affects children and adolescents. It happens when children are above the normal weight for his or her height. Obesity in children can also lead to obesity in adulthood. There are many things that obesity in children can lead to. Children are at risk of strokes, high blood pressure, type 2 diabetes, and coronary heart disease. Other risks include liver and gallbladder disease, sleep apnea, respiratory problems, and increased stress on joints, eating disorders, and it lowers self-esteem. Now let's examine the causes of childhood obesity. The family is one cause of childhood obesity. Children with two obese parents are at a greater risk for being obese. Genetics also play a role because if children come from a family of obese people, they are automatically at risk. Parents that have bad eating habits pass it down to their children. Parents are responsible for buying food, which means a lot of times they buy more snacks than healthy foods. Family issues can also affect children. Some kids will eat in order to cope with emotional problems or to deal with stress. Diets can also cause childhood obesity. Children consuming high-calorie foods can contribute to weight gain. Some high-calorie foods include fast foods, baked goods, and vending machine snacks. High-fat foods also have a lot of calories. High-fat foods consist of sodas, candy, and desserts. These foods are also high in sugar. Even though children love these types of food, they aren't really good for their health. Inactivity is another cause of childhood obesity. Children can consume lots of calories but don't burn the calories with physical activities. These days, children are more into leisure activity that doesn't involve too much movement. They are more into watching TV, playing computer games, and playing video games instead of playing basketball, playing tennis, or softball, or just running outside. Now let's examine ways to treat childhood obesity. Healthy diets can treat childhood obesity. Since parents are responsible for the foods they buy, they should buy more healthy foods. Even small changes can make a big difference in your child's health. When buying groceries, you should buy fruits and vegetables instead of foods and high sugar for your children's snack. Parents should limit sweetened beverages and instead encourage children to drink more milk and more water. Parents should eat dinner with their children at the dinner table, which discourages them from eating in front of their TV. Physical activities can also treat obesity. Parents should get their children involved in activities so they can burn calories. Children can get involved in many activities such as cheerleading, swimming, ballet, football, soccer, and etc. For children who suffer from a more serious case of obesity, they can be treated by medications. There are two main medications that are available. They are only available for teenagers. The first drug is called Vita. This particular drug alters the brain chemistry to make the body feel fuller more quickly. The other drug is called Orlistat. This drug prevents the absorption of fat in the intestines. Another treatment is weight loss surgery, which is for severely obese teenagers. Many teens choose this option when dieting and exercising doesn't really work. Weight loss surgery can be safe, but sometimes have complications. Parents should keep in mind that surgery doesn't guarantee that your child will stay small or that they will lose excess weight, which is not good as a long-term option. Now let's examine ways to prevent childhood obesity. Parents should set a good example which can prevent childhood obesity. Parents should be seen by their children eating healthy. Parents should snack on fruits such as apples, grapes, or bananas. Also, parents should snack on celeries and carrots. When children see their parents eating healthy, they will follow. Also, parents should become involved in physical activities and invite their children to join them. Emphasizing the importance of being healthy can prevent childhood obesity. Parents should explain to their children that being healthy will help them to have strong bones and muscles. Also, being healthy can help them have strong hearts and lungs. This should help to manage your child's weight. Scheduling regular doctor appointments can prevent childhood obesity. During the visit, doctors can measure your children's weight and height and inform you if your child is at risk of childhood obesity. In conclusion, parents play a role in their child's health. Parents, remember never to use sweets as a reward for your child doing well. Also, limit the number of times that your family eat out. Parents should find activities that your children like to do and join them. Limiting the time your child watches TV, plays video games, or uses a computer can encourage them to do more physical activities. There are many activities families can do together. They can go bowling, skate, ride bikes, volleyball, and other many things. Parents, just remember to make your child's health your priority along with yours. And on my presentation, I have the following things that are considered good habits as far as eating vegetables and fruits, carrots, oranges. Activities include soccer or just playing out in the yard with your kids. Bad habits as far as eating is Hawaiian punch juice, Little Debbie snacks, pancakes, chips, sodas, and ice cream. Those can cause a child to gain excessive weight. And this is my presentation.